Everyone. I'm Dr. Sara Cody. Today, I'm here to announce that we will continue to base our decision about removing the indoor masking requirement on the risks currently posed by COVID-19. We've established metrics that tell us when it will be appropriate to lift the requirement for indoor masking in all public settings. Recall that the requirement for the use of face coverings in all indoor public settings was put into place last August during the Delta surge to add an important protective measure in addition to vaccination. Currently, we are emerging from the Omicron surge, and it's been about a month since the peak in our cases, and our case rates are 40% of what they were. But we still have very high levels of community transmission, still higher than at any other point in the pandemic pre-Omicron. And so the risk of being exposed to someone with COVID in our community is still high. I know that some may be weary of masking, while others are anxious about the consequences of people unmasking. And there are various and strong opinions in our community. But ultimately, our job is to follow the science, to keep our community as safe as possible, and to ensure that we continue to protect the people who are most vulnerable. To do this, we cannot lift the indoor mask requirement with community transmission as high as it is right now. That being said, we do realize that the metrics that we adopted last October do need to be adjusted to match the Omicron context. So I'll review each metric that needs to be met to lift the indoor masking requirement. 1, vaccination rates are high. We have met this metric as over 80% of our total population, 84.1% as of yesterday to be exact, is vaccinated. This reflects a real commitment on the part of everyone in our community to keep our community safe and should be celebrated. 2, hospitalizations are low and stable. We've not yet met this metric as our hospitalizations have plateaued but are not yet on their way down, though we do hope and expect to see them trending that way very soon. And finally, the third metric, that transmission rates are manageable. So this used to be based on us meeting the CDC moderate or yellow tier and remaining there for 3 weeks. But this last metric is being adjusted to reflect the difference between Delta and Omicron. So I can walk you through the details for the revision of that metric. But what's important to know is that we will now be following the 7-day average of cases reported, and that's what you can see on our public dashboard and follow along. When we are at or below a 7-day average of 550 cases a day for a week, we will have met this metric. So I am hopeful that with Omicron continuing to decline, that it won't be too long before our hospitalizations are low and stable and our community transmission will be low enough to transition indoor masking from a requirement to a strong recommendation. We are all looking forward to being between waves of this pandemic and at a point where we can roll back some of these protections that we have all now been using for a very long time. And I'm hopeful that this approach that we are adopting will allow us to do so in the near future and in a way that is most responsive to our data and to our commitment to keep each other, and particularly those who are most vulnerable among us, as safe as possible. Thank you.
We'll now take questions from the media before moving on to the Spanish portion of the press conference. We'll call out everyone individually, and we will start with the Mercury News. Please identify who your question is for. Thank you.
Yes, thank you for the question. The question is this being coordinated? What I can tell you is that in the Bay Area, we always continue to work together, and we are a pretty tightly knit group of peers that bounce ideas off of each other. We don't always reach the same conclusions, although we deeply respect each other. The other Abajo counties I will let speak for themselves.
Yes, so masks will still be worn indoors, but we know Tuesday the governor has removed that. So you're in lockstep with what the governor's doing on Tuesday, right?
What we are saying is there are three. I want to back up and just clarify. There are a number of rules that govern indoor masking. There are federal rules around masking on transportation. There are statewide rules that will stay in place for indoor masking in high-risk indoor settings like healthcare, congregate settings like shelters, jails, etc. And then there's the general all indoor public settings mask mandate that the state has had in place, as well as counties like ours since last August. What's changing at the state is that effective February 16th, they're lifting it to be effective on February 16th, the all indoor settings part. We're taking a different course in Santa Clara County in that we are continuing to follow our data and metrics to tell us when it's appropriate to lift. So that's the difference.
So the masks, as far as Santa Clara County, will still be fine inside.
That's correct. The masks in Santa Clara County, people will be required to wear them in all indoor public settings until we meet the metrics.
Regardless of age, because I know the governor wanted school kids to still wear the masks.
Yeah.
But in Santa Clara County, regardless of age,
Yeah.
you walk inside and you wear a mask.
If you're indoor public setting in Santa Clara County, you wear a mask until we meet the metrics. The vaccination metric that we've already met, hospitalizations low and stable, we hope to be on our way soon, and that the case rates in our community are manageable.
What about schools? There's a debate right now about when kids should take their masks off indoors in schools. Do you have any thoughts on that?
The question is around masking in schools. The masking requirement in schools is a state requirement that's part of their K through 12 guidance. That's a state requirement for masking in schools, and the state is not lifting that on February 15th.
Do you have any guidance? Do you have any personal thoughts on whether or not the risks and benefits, that debate's going back and forth? Do you have any thoughts on that?
In general, we do try to align with the state as much as possible, and we have been aligned with state K through 12 guidance since the summer of 2020, if I recall. So we are following the state guidance for K through 12, including masking.
KPIX?
A two-part question. You mentioned hospitalizations as one of the metrics. Is there a number, a certain amount of hospital beds being open to meet that metric? And then just looking at the curves, are you able to predict when you think we might meet those metrics? Weeks, months?
Thank you. The question is around hospital metrics and when we might meet the daily case number metric. We do not have a specific number of when hospitalizations are low and stable, and the reason why is that hospital capacity is a little bit elastic, and there's many, many factors to consider. I would say that last October, we had reached a steady state. Hospitalizations were bouncing up and down, but not too wildly, so that would be considered low and stable, and we're looking to get back to a place similar. As far as our case numbers, our models show that we are likely to get there by early March, perhaps a week earlier or a week later.
ABC?
One question, if I can just masks, with the CDC saying cloth masks aren't as effective against Omicron, you need the N95. And so why double down and go against the state and require masks when some wonder, especially with vaccination rates being so high here, are they really necessary? Are they really effective?
Masks are a very important additional layer of protection, and as we've talked throughout the pandemic, we need to layer up and have many layers in place when when there's a lot of COVID circulating. Right now, we are still at high levels of community transmission. We're at the CDC red, in fact. And that's why we are still requiring masks indoors. There's different levels of protection offered by different masks. An N95 is the most protective. And then a KN95, such as I'm wearing, is also protective, although not quite as much as a N95. We recommend that people wear at least a surgical mask or more as far as protection. Another very protective way to go is to wear a surgical mask with a cloth mask on top to improve fit.
Thank you. When the news came out that the governor was going to lift the indoor mask mandate next week, I'm sure there was a sigh of relief from the Santa Clara County residents that there was a sign of this, some normalcy coming. I mean, what's your message to Santa Clara County residents? About this?
My message to Santa Clara County residents is that I am hopeful that given our current trends, that our community transmission will come down. It's coming down rather briskly, which is wonderful news. But as always in our county, we follow the data, follow the science, and we're going to follow the metrics that we set in place. We are concerned about members in our community who are vulnerable, and we don't want to leave them behind. So if you're still at risk of Omicron because of your age or your medical condition, we want you to feel like you can be in public too, and that the community around you will continue to protect.
Is there a projection when you think this is going to change?
We, as I mentioned, there's 3 metrics that we're following, one that we've met. I expect that the hospitalization metric will probably be the second metric that we would meet. And then we'll look at our community transmission. And our goal is 550 cases per day, 7-day moving average. And then we hold there for a week before we lift. Our models suggest that we may get there sometime in March, early mid-March. And we'll be following that. And you can follow along as well on our dashboard.
San Mateo County has just lifted theirs, or they plan to next week. Any concern that people will go to restaurants and gyms and they'll just cross the county line and it won't hurt businesses here?
I want to be clear that the indoor masking requirement that we put in place last October did not close gyms. It did not close restaurants. So all of those activities are perfectly fine. People are able to judge their own risk tolerance. So I don't expect that this will change that.
A final question, Mercury News?
I'm sorry, you want to get to cases 550 per day. What is it now?
It is now, I believe, at around 1,900, a 7-day moving average of around 1,900 cases per day.
550
That's correct. I would say that week to week, our cases are dropping about 40% each week. We hope that continuing to require indoor masking in public settings will help us reach that goal faster and bring down the level of community transmission faster.
Thank you, everyone. We'll now
Thank you.
move to